Hello, welcome to my restorative physical therapy. I'm Dr. Jenny Pruitt, and today we're going to be talking about tennis elbow. Not everybody that gets tennis elbow plays tennis. The more anatomical name for it is lateral epicondylitis. That is the bony part of the outside of your elbow is the lateral epicondyle, and there are several muscles that start there as they make their path towards the wrist and the hand. And so I think of the muscles as just kind of creating a tug of war on that poor little bony prominence, and it ultimately gets irritated. So lateral epicondylitis, I like to talk about how it's a little bit of a misnomer. So now we no longer call it lateral epicondylitis because there's no inflammation that we can tell from it. So we've started calling it lateral epicondylosis. So all three of those things are interchangeable: tennis elbow, lateral epicondylitis, and lateral epicondylosis. So if you hear those, we still use all three terms equally. Just depends on who you're talking to and who wants to use which term. So hallmark signs are pain at that outside of the elbow, especially with gripping, and computer work typically as well. So those are kind of the three hallmark signs. There's some other things that I see as well. Things that are kind of humbling, like pushing the remote buttons, pumping the soap dispenser at the sink, so like that pumping motion, sometimes even lifting the coffee cup, or in really severe cases, people will feel like it's uncomfortable for their arm to hang down at their side to arm swing while they are walking, and they'll want to kind of splint the elbow in towards their side to protect it. So those are the hallmark signs of lateral epicondylitis. There's really not a need to see the doctor first unless you think that something is torn for whatever reason, or the onset of your outer elbow pain is actually from a fall, like you fell onto your elbow. So those are reasons, but if it's truly the muscular tendon irritation, long-term signs of degenerative stress, then you are safe to start with physical therapy. So if you want those top tips and those exercises, head on over to the tip sheet now.